Welcome to the Latin MedTech Leaders Podcast, a conversation with leaders who have succeeded or plan to succeed in Latin America. Please subscribe on your favorite podcasting platform, Apple Podcasts, Spotify, Google Podcasts, Amazon Music, etc. Today, our guest is Jacobo Luchtan, co-founder and CEO at HelloDoctor, a Mexican startup providing data-driven telehealth services. So, Jacobo, it's great to have you here today. Welcome to the show.
Thank you, Julio. I'm so happy to be joining you. Thank you for the opportunity.
Awesome, Jacobo. So let's get started here. Um, could you please tell listeners about your journey? I mean, how is it that you got involved in Mexico, Latin America in general? What's the genesis of what you're doing today?
Yeah, I was first of all I'm Mexican. I was born and raised in Mexico, and I've worked abroad, but I've mainly worked in Mexico and Latin American countries, Spanish-speaking countries specifically, and my journey in Latin America has been through different sectors. I've worked in the security intelligence business. I've worked in the fitness sector also, and now I'm working in the health tech sector. And what I can say about Latin America is that it's a market full of potential and full of growth, and there's tons of opportunities that are probably already explored in Europe and in the USA, and that in Mexico and Latin America, in a very briefly way, they've been explored. So it's a super opportunity. I love to work with Latin American people. We're very passionate about our work, and there's goods and bads, but I'm very happy, and I plan to continue working for the rest of my life in this sector.
Beautiful. Excellent, Jacobo. All right, so let's start with, or let's continue with trends. What trends do you see happening in Latin America today that are relevant to our discussion or relevant to the telehealth services that you're providing?
Yeah, well, right now I see a major trend regarding technology. In the past, technology hasn't been the strength of the Latin American sector, the Latin American countries. You rarely heard of unicorns or of really big startups coming from the Latin American scene. And now you go into LinkedIn every day and you hear a new one every day. And that gets me super excited. It's become my daily morning routine to see what's happening with with the sector, and it really gets me very emotional, and I'm very happy that finally Latin America is starting to become a market that can be a leader or a trend for many of the different sectors regarding like e-commerce, telehealth, and many others coming. Obviously, the epidemic, I think the COVID epidemic was a very big player in this part because many Latin American countries were very strict with their uh, COVID rules, and many were not at all, like Mexico. so, so maybe, I mean, for some, or at least on my sector, on the telehealth sector, we saw like a significant advantage, like people that didn't know what a QR code was after COVID, like everyone knows how to use it. All the smartphones can scan it, or everyone has an app to scan them. And like the epidemic really helped the sector. And I think in Mexico, there weren't many rules regarding COVID. Like you didn't have any mandatory, you didn't have to stay at home by obligation. So you could work still with people. You could see people. So I think this was a very positive thing that happened, and maybe one of the reasons that the whole startup scene and the whole like digital healthcare ecosystem started to grow and had a very big push. Like before, I'm a very fan of analytics and statistics. And before, you could go in on Statista and you would see the market penetration or the user penetration of telehealth services in Mexico and Latin America, and it was below 2% a year. And now with the new with these new trends, and because many doctors were without work for a year almost, and to uh, they had to move to a remote way of or an online way of giving their care. So the user penetration of telehealth has increased significantly, at least in Latin America.
Wow, that's good. That's good. You're bringing up very good points. I don't know where to start. I mean, the cell phone penetration is a big trend.
Yeah,
Definitely, the digital services, people are now interacting with the government, interacting with private companies on their cell phone. And there's even a comment that I heard somebody in the U.S. It was, I think it was in one of these interviews. He said, "The cell phone is a new clinic." So people and doctors, I mean, patients and doctors are starting to realize that we can do so much with technology in healthcare. And traditionally, healthcare hasn't really adopted many technology tools. I mean, EMRs are kind of a new thing. I mean,
yeah,
that's very surprising.
yeah, that's right. And that's actually one of the touch points, one of our pain points that we live through with every day is that usually the doctors are not very friendly with
Yeah.
technology.
Yeah.
They like to do things their way, and they like to write on the
Yes. Yeah.
paper all the registrations of the medical
Yeah.
records of the
The
patients and everything, all
prescriptions.
the prescriptions. And now they're starting to see that technology is a friend and that it's pretty simple. The the problem that I think caused it is because many of the different platforms and technology that existed on the healthcare ecosystem was very robust and very complicated. So when a doctor was trying to use it, it took either a very long onboarding process or they quit and they didn't continue. And we've been receiving a very good acceptance of our product because it's simple. That's one of our slogans.
Hmm.
Our like mantras is to keep
Yeah.
things simple. I don't know if you've heard of KISS, no? Keep it.
Yeah. Keep it simple, stupid. Yes,
Yeah,
sure.
that's right. So that's like I just had a sprint meeting with our development team. We were talking about some sophisticated algorithms to rate the doctors, and we're like, no, this is not simple. We just scrapped everything and we started
Really?
from
Wow.
scratch because it wasn't simple to understand.
Huh. Very good. Very good. Yeah. Albert Einstein used to say, keep things, no, okay, make things simple, not simpler.
Yeah, that's right. Make things simple, not simpler. That's a good one. I'm gonna use it.
Yeah. Yeah. Albert Einstein used to say, it's one of his famous quotes. Anyway, so let's continue here, Jacobo. So let's talk about Hello Doctor. I mean, what is it that you guys are doing today in Latin America?
Yeah, I mean, we started HelloDoctor in July 2019 before the epidemic, and we started with the idea of uh, increasing the accessibility and quality of healthcare services in Latin America. Unfortunately, many countries, and the one that I know more, Mexico, has a public healthcare that lacks a lot of things, both in accessibility and quality. Like
Yeah.
I've been to the public hospitals many times to see what's the experience over there. We've been like giving flyers out about Hello Doctor and
Really?
with yeah, and
Okay.
and then like 2 out of the 5 times we've done it, many police officers like trace us because you cannot do those types of things outside of those hospitals. But that's an anecdote for another time.
Yeah,
Um,
exactly.
but that's a
I mean, it's
way.
public space, right? It's
Yeah,
public. It's the street is public.
yeah, that's right.
Anyway, that's another discussion. Yeah.
Yeah, but I mean that has helped us a lot to find product market fit, no,
Sure.
and to be with to be with the people, and we identify that there's the public healthcare in Mexico specifically, it's not good. It's actually broken. So we tried to. Hello Doctor was born as a doctor-centric platform. Our idea when it was born was to give the doctors this digital office where they can invite their patients and give them telehealth consultations via video, audio, or chat. And then after a year, we found out that the doctors really don't want to move the way they are working, and it's very hard. But we identified that we as patients, we do want to move. We do want to get healthcare through like, and not being to have to go to the hospital and moving 2 hours away to go to the hospital and to be able to give accessibility to a doctor for people that are very far away in rural areas, in remote areas. So we moved our focus to a more patient-centric platform. and we successfully released the one of the, I don't know if the only, because I don't know all of the platforms, but I can say we're very unique in launching a completely free telehealth service. We launched it
Yeah. I've
in
never heard about that actually.
yeah. So the experience is that you download HelloDoctor. It takes you 30 seconds to schedule a consultation. A doctor calls you through video, audio, or chat. You choose whatever way you want it, and they give you the consultation. They diagnose. They give a diagnosis, a treatment plan, a digital recipe, and you can even order the recipe from the app, and it can be delivered in all around Mexico. So the
Wow.
delivery, the drug delivery or the medicine delivery is nationwide. So that was one of the first services that we released. We released that service in August 2021. Unfortunately, we've reached almost 3,000 successful consultations, and obviously it has been a rough path. We've changed things around,
Yeah.
and
Yeah.
I mean we've had like difficult experiences where the platform just goes down for a couple of days and we lose a bunch of
Wow. Terrible.
consultations. Yeah, but it's normal, and but it's I mean we're very happy. Like we really enjoy our work, and the platform is open in all Latin America. You can use it and you can download it in all Latin America. Actually, in the whole continent, in all America, you can also use it in the
Yeah,
United
yeah, yeah.
States,
Anywhere. I mean, so
anywhere.
anywhere in the world, anybody who speaks Spanish,
I mean,
you can
right
serve.
now, because of some compliance things, we're not available in Europe and Asia.
Oh, you are limited to certain countries in Latin America. Okay,
Yeah, because we're compliant with HIPAA, we're compliant with Mexican laws, and with Brazil and other things. So that's why we release the app in those countries.
Okay,
That way, we don't
got
have
it.
any liability. But GDPR, we're not compliant with GDPR yet. That's for
In
Europe.
Europe, yeah. Okay,
So that's why we
makes
didn't
sense.
release it. So yeah, and right now we're actually working on a new functionality where you can choose your language, and we tell you which doctors speak Spanish or English. So also English speaking people can take the consultation. So yeah, I mean, we've been focusing on being completely like patient centric, and we released this service in order to understand what are the patients looking for, what are users looking for. We released it originally only with general medicine, but right now you can get free consultations for general medicine, veterinarians, nutritionists, psychologists, and physiotherapists. So those are
Veterinarians too. I mean, you
yeah.
can also get a consultation for your pet.
That's actually one of the trending specialties that we're
Wow,
seeing
never
that
heard that
people.
before.
Yeah,
Wow.
because like if you have a no, I don't know, a sore throat, you know you have a sore throat, and you
Yeah.
maybe know that you can take some vitamin C. But if your dog, for example, has, I don't know, he doesn't feel or you see him like acting strange or under the weather, like he cannot tell you anything, and it's
Sure.
very like we've found a way of having a use on the platform by putting a veterinarians there, and many people use them, and there's many people that use them many times a week because they think their pets are having a problem or whatever, and it's been one of the use cases that is having a lot of
That's very unique.
yeah.
Yeah. Okay. Yeah, I heard about a company in the U.S. that is doing dentistry. Dental consultations, and that's something I haven't seen in Latin America yet.
Yeah, actually, that's one of the that's on our pipeline.
Sure.
It's a little hard because I mean, obviously, there's specialties that are more friendly with telehealth than others. For example, an
Yeah.
endocrinologist doesn't need to see you every time. He just
Yeah.
reads some
Yeah.
tests, reads
Yeah.
hormones, and overall, he can tell you what you have and give you a treatment plan. But uh, a dentist, like usually, you have to go to the dentist. Like here, he's gonna give you a drug or he's gonna give you a preventive treatment, but you're gonna have to eventually go to the dentist if you have
Yeah.
a problem.
Yeah. 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 Yeah.
Yeah, but yeah, those are we try to focus on we were trying to focus on the specialties that are more friendly with telehealth,
Sure. Makes
and
sense.
but the idea is to uh,
Of course.
move forward from there. And I mean, right now we have three services. One is the free telehealth consultations. The other one is a service that we released a couple of weeks ago that is called Express Consultation. So you can talk with like second level specialists. Let's say like we call them like a first level would be a general physician. A second
Oh,
level would
okay.
be a a pediatrician, a gynecologist, a cardiologist, an endocrinologist, like someone that you already know. Like if you're going to go with a cardiologist, it's because maybe you already went with a general practitioner or you Googled a lot. So you can know that I want to go with a cardiologist. So the idea here is that you can talk with a specialist for $5.
$5. Okay.
Yeah.
That's a paid service. The free level is general practitioner is free. The second level specialist is $5.
It's just $5. That way you're able to talk with a specialist, and then if you like the specialist, you can have a follow-up consultation. But maybe that follow-up is going to be at their office with their standard rate. And the third service we have is we call it the HelloDoctor Hospital, which is we have more than 800 doctors that have created their digital office with us. That you can look for a dermatologist, for example. You filter in the search engine the dermatologist. You can find we have 20 dermatologists, and you can see all their track records. You can see their reviews. You can see what are their prices. You can see where they are located. And that way you just see a menu of the doctors we have, and you pick them, and that way you have a consultation. And the prices of those consultations are based on each doctor. We have doctors from AAA hospitals that maybe charge $100 a consultation, and then doctors that maybe just started their practice and the consultation is $20.
Yeah, sure. So it's more like a directory,
like a
prime or the top physicians.
That's right, and the doctors that are in the free telehealth service and the express consultation are HelloDoctor doctors. They're HelloDoctor practitioners. So we hire them.
The first level, the second level, HelloDoctor employees, internal doctors.
Internal
the third
doctors.
level is external specialists.
That's right.
Okay.
That's how it's structured. That way we were able to control. That's why we're able to give it so cheap, because we are right now we're absorbing almost all of the consultation prices.
I can see that $5 is very low. I mean, to pay a specialist.
To pay a specialist for $5, it's not even the cost of a copay.
Yeah, exactly.
So
and Jacobo, how can people pay for this? Because in Latin America, there's always a challenge of
the payment methods.
Not many people have bank accounts or credit cards, debit cards. It's just difficult.
Yeah,
kind of informal economy out there in the streets.
That's right. I mean, right now you have two payment methods, and we're expanding them. Right now you can pay by credit card or debit card. You just add it there, and it's just charged when the consultation is finished. Or you can pay in OXXO. OXXO is a convenience store that has thousands of convenience stores in Mexico. It's
like 7-Eleven in the US.
7-Eleven times 10.
Times 10.
Yeah, I mean...
Wow. Yeah, that's true. I've been to Mexico City. I've seen it in every corner. You see an OXXO.
Yeah, so when you want to pay for a consultation, you can say, okay, I want to pay in OXXO. You get a QR code, and then you go to the OXXO, you scan it, you pay for your $5, and then you get the consultation confirmed, and you can have the consultation, so that way you can pay cash.
That's genius. That's really good. I mean,
we implemented that a month ago almost. Okay, yeah, so it's one of the new things that we have on the platform.
All right, so let's talk about coverage. I mean, let's say somebody in Colombia wants to access the service, downloads the app, and wants the $5 or the third level consultations. I mean, can you accept payments? Are you compliant with local laws and everything?
Yes, because I mean, to be super straightforward, we're not using we're not a fintech. We don't save the data, so we're using a third party to manage all of the payment from third parties, and they have coverage all around the world. And so, like, based on your answer, is our coverage is all America, so practically. I mean, if you're in Chile, if you're in Argentina, if you're in Colombia, if you're in Canada, if you're in Alaska, you can download HelloDoctor and schedule a consultation. The experience you can have is the same as if you were in Mexico. That's the advantage of.
So you have an OXXO equivalent.
Okay. Regarding OXXO, okay. So the coverage in all Latin American countries that don't have OXXO, it's only credit card and debit card.
Exactly. That's what I meant. Oh, okay. That was really my question. Oh, okay. So you have to get into agreements with the equivalent of OXXO in Colombia and Chile, because OXXO in Colombia, for example, has limited locations, not as many as in Mexico.
Yes, that's right.
That's kind of a new thing.
Yeah, that's right. Like FEMSA, which is the guys that own OXXO, I think they have already in Peru, Colombia, and they're expanding slowly. But yeah, I mean, in order to pay for our services cash, we need to find coverage in all of the other countries.
Yeah. All right, but still,
That's
it's good.
on the pipeline.
Okay, that's for the second level. For the third level, do you have already doctors in the directory in other countries?
Right now, all the doctors right now are only in Mexico.
Okay.
Yeah, when we open our next office, probably it's going to be in Colombia. We're gonna open the market to doctors. The thing is, we are very rigorous with the quality of our doctors, and we need to see them. Like we're if we want to hire a new doctor, at least for our free consultations and for the the express consultation, we need to be able to at least see them once a month. Like we have a massive meeting once a month with all of the doctors. Last month they were 40 doctors, and they tell us a lot of feedback on the app. They tell us feedback on the patients, misuse on some of the on the patient side. We've been having some of those cases also, that they misuse the telehealth service for something else. So we don't plan to open up to doctors from other countries unless we open an office.
Sure. Yeah, makes sense. Yeah. All right. So, Jacobo, let's talk about challenges. I mean, what's been the most pressing challenge or set of challenges you've had in Mexico and the other countries in Latin America?
Number one challenge is making the app work. That's the number one challenge. Like in making the app work for each release, that has been one of the main challenges.
Each release.
Yeah, each release, it's a grueling job to test everything out to see that we have the minor amount of bugs possible. And the other challenge has been that the patients take the consultations because like
market, sales. Yeah.
Not only sales. Like fortunately, the market has liked our ads and has liked our platform, and we've been having a very aggressive growth. The thing is, they don't believe the service. So our marketing is get free consultations now, and usually what we've been seeing is that the users look at it and they say, no, it doesn't.
It's impossible. Yeah, nobody does this.
They download the app. It takes them 30 seconds to do it, and then to schedule it, and then in the next 2 hours or maybe the next day that the doctor is calling them and they receive the call on their phone, it's like, no, I don't really want a consultation, and they hang up. So we've been having a lot of those issues. I can say maybe 30% of all of the schedule.
Really?
30%.
Just curious. Just want to know if it is true or not.
Yeah, maybe 30% of the consultations we have, unfortunately, are unsuccessful consultations. That has been one of the challenges. And we're improving it. We're improving the communication. We implemented a WhatsApp integration so we can communicate with the patients 10 minutes before the consultation, and we invite them to the waiting room in order for them to.
Okay.
So we're trying to implement some ways for this to not happen, but this has been one of the challenges. That's why when I'm saying 3,000 successful consultations, it's just 3,000 patients that were connected with doctors with a diagnosis, and then that they get treatment plans. It's not just that they schedule something and they don't get it.
Another challenge that I see here is with local laws. And I'm going to tell you what is happening in Colombia, at least that I know, because Colombia is it's my home country, and we do a lot of business in Colombia. And in 2017, 2019, something like that, they issue new laws for telehealth. And one of the restrictions that they have is you can only offer, they call it in the law, teleorientation services. You can guide the patient, but you cannot do an actual medical consultation yet. You need to be a brick and mortar, a building, a clinic, a hospital.
In order to do a proper consultation.
You own servers, you own doctors, your own app.
Yeah.
So that limits innovation in this space like you're doing in Mexico. So that's something to consider when you start growing in other countries.
Yes, of course. And I mean, you've addressed one of the issues that we had when we were first born, which is what do I call my service? And in Mexico, there's no current law that says that you cannot say it's a consultation, but it's not accepted. That's why, I mean, if you download the app, you're gonna see that everywhere we don't say consultations in Spanish. We say asesorías, which is orientations also. But in the end, I mean, it's not like our doctors are giving a different service because it's an orientation or it's a consultation. It's not like we don't limit the time of the consultation to 20 minutes. A psychologist's consultation can go up to 2 hours, and they can use the app for 2 hours, and they just go. It's just it's just a word. It's just a word, and it's yeah. And this word, I think, was created to protect the the real physical consultations, because something that is true is that you cannot do what the same in a physical consultation in person and in a telehealth consultation. Like, you cannot do the same amount of things, even if you had digital devices in order that measured with a very low error margin the heart rate, and to be able to see with a high definition camera at the throat. I mean, there's ways of doing those, but it's not it's not the same service, and that's why also the doctors usually give or charge less for a telehealth service than an in-person consultation. So I think it's good that the different governments are differentiating from a consultation and an orientation. But I think we're gonna move I don't think it's a threat, but it's we're just have to do it right. That regulation is coming our way, whether we want it or not. Like, just last week, the Mexican Senate released a document where they plan to implement regulation in telehealth, a 27-page plan to implement, and it's very political, but it's coming our way. We just have to be prepared and to try to do it on our own terms. But it's one of the threats slash opportunities that we have.
Exactly, exactly. Well, and in the rest of Latin America, beyond Mexico, in what other countries you've seen the highest adoption?
Argentina is crazy.
Argentina. Huh.
Yeah, Argentina. Like, when we released the service, Colombia and Mexico were on the top. Mexico, maybe 60% of our users were Mexico and 40% Colombia. But in the last 3 months, I've seen something like Argentina had a user growth of 2,000% in the last month. They grew
Wow.
like out of.
What happened?
I have no idea. I would love to tell you. Maybe they liked our new ads. they liked the words that we're saying, I guess. But Argentina has been one of the main ones. Chile also, Ecuador, Venezuela. Like, they've been liking it a lot. Like, the US, it's up and down, and
Okay.
we've been having some users also from India and other countries that probably are living over. They're living over there, and they have their app store linked with some country in Latin America, and that's why they're being able to download the app and get a consultation over there. And
I see.
But yeah, I mean, the main countries that maybe we would have, if I was to decide today where to open an office, I would say number 1 Colombia, number 2 Argentina, probably.
Huh.
See, even
Fascinating.
though Argentina economically is not very strong, but
Yeah.
we've seen numbers that we haven't seen in other countries.
Excellent. I'm glad. I'm glad to hear this, that you already have solid market traction in these countries. And you also brought up something that not many people talk about, which is the U.S. The U.S. is another country in Latin America. I mean, there's probably 40 million
Yeah,
Hispanics in the U.S.
yeah, not only 40 million, 15 million of those are immigrants.
Yeah,
And
exactly.
yeah, that's another super big audience that probably in the future we're gonna be able to give them services. And because, I mean, right now they can get telehealth, but they cannot get a recipe in the United States. They get
Exactly. A
a
prescription.
prescription.
Yeah.
That's right. So we're working towards being able
Okay.
to do that possible.
So with the pharmacy, let's talk about that for a minute before we close, because we're close to the end of the show. So you said that at least in Mexico, you can fulfill the prescription
Yes.
and send the drug, whatever it is, to the patient's house.
Yeah.
In what time? 24 hours, 48 hours?
If you're in Mexico City and it's before 5 p.m., you can get it the same day.
Wow.
And if it's outside of Mexico City, between 24 to 48 hours.
Very good. Very good. And of course, there is that's a revenue source. I mean, you make money with that service.
Yeah, I mean, we have a rebate. We use another service that we don't do the delivery.
Of course, it's a third
It's a
party. Of
third
course, yeah, I
party,
know it's a logistic company
and
that
we
picks that ship.
and we get
The
a very small revenue of all the recipes that are fulfilled through our channel. And we also have, through this same partner, we have like when you get a recipe from HelloDoctor, you get a barcode for each medicine. And when you go, like we have partnerships with, I think it's almost 10,000 points of sale, different pharmacies in all around Mexico. But if you
yeah,
go with
yeah.
our recipe and they see our logo with with the barcode, you can get discounts.
Wow, that's
So
great.
it's one of the benefits that you have of also getting a consultation with HelloDoctor. It's free, and then you get a discount
Okay, so
on the
you go.
consultation.
If you're in the U.S., our audience is mostly in the U.S. So you have a partnership with CVS, with
Yeah,
Walgreens, for example,
that
in Mexico.
yeah.
So I go with the app, and they will fulfill at a discount.
Yeah, they scan the barcode. If it's a generic medicine, usually there's higher discounts up to 50%.
Sure.
And if it's a branded medicine, you can get up to 10% discount, something like that. But the idea is to eventually have this service available in the United States and that you can go with the Hello Doctor recipe. And if it's not a controlled drug, like an antiseptic, like a psychotropic drug, which is
Yeah.
very
Hmm.
sophisticated,
Hmm.
you can get it just sorted out on any Walgreens or any CVS. Yeah, but
Wow, very
there's a
good
lot of
to know.
compliance in the United States
Yeah, of
and
course. Yeah, yeah, I
liability.
know. That's a different
Yeah,
market. Yeah, different
yeah,
rules.
but
Yeah,
we're starting to explore it.
yeah, yeah, absolutely. Well, I mean, this is fascinating, Jacobo. I am so impressed with your work
Thank you.
and your team, of course. And what about competitors? I mean, who else is out there doing something
Well, I
similar?
can say that at least since COVID started, I can name 100 startups that are focusing on telehealth in Latin America. And out of those 100, probably some are not they do not exist anymore. But there are many competitors. There's also market for everyone. And what I have seen is that every platform is different. Every platform has a different angle. There's platforms that more are more focused on corporate, like on like healthy company solutions. There's platforms more focused on the doctor instead of being more doctor centric instead of patient centric. There's many different flavors and options, and that's why I would say that we're very unique in the services that we provide. But I think that I mean every time I see a new one, that's good news because it's someone it validates the space. It validates for the venture capitals that it's a space that many people are trying or that see that there's future on it, and there's market for everyone. I mean, the outpatient consultation market in Latin America is huge. So
Yeah,
so
it's so huge that I think that Rappi is getting involved in telehealth.
yeah,
Correct me if I'm
yeah. I
wrong.
mean, one of our services, and we're exploring that path with them, is we call it TAS, Telehealth as a Service. So we made a bundle of our free consultation service. It's an SDK, and you can plug this into any platform. So we're talking about
Great.
insurance companies that have their own apps like Bupa. We're talking
Yeah,
about
that's a great idea.
fintech, e-commerce, like all of these platforms. Like if you're listening to this and you have one of those, give us a ring. We have a
Yeah.
SDK that you can put in your platform, you can put in your app, you
Wow.
can put in your platform, and it's really amazing because it makes your product deeper. No, one of the things that makes Google it's that it's super deep. Now you have many things you can do with it. And if you are, I don't know, a fintech and you give credit to people and you just in 2 weeks you can plug in a telehealth service and you make your product deeper like that.
Sure.
So
Yeah.
yeah, it's one of the services that I'm very enthusiastic of seeing that product grow a lot.
Very good idea. Yeah. Excellent, Jacobo. All right, Jacobo, we're close to the end of the show. And the last question that I have for you here is something that I always ask my guests towards the end of the interview, which is if you had the CEO of a company in the United States or Europe that is just thinking about investments in Latin America or starting a company in Latin America, or trying to sell product or service in the region, what would you say to him or to her as last words of wisdom?
What I would say is that um, it's a market with a lot of hunger and with a lot of opportunity, and that has been it has just tons of potential. I mean, I mean, if I were to start a telehealth platform in the United States, I would not grow as fast as I am growing. I mean, like the users, the Latin American people are amazing. They're very passionate people, and they're eager to have more, to get more. And if we put it on their hands and they can understand it, I mean, they can throw you to the sky. They can drive you. Like, it's amazing. The Latin American people and the market it's just crazy how if you find something that they will like, they would just like, you would be amazed at how the level of acceptance they would have. And like, we have a meeting once a week with the whole team where we read the success cases. We had the current week. We have one person that's only focused on talking with patients and documenting all the success cases. And we have more than hundreds in all of Latin American countries, I think, except for Brazil, because we don't speak Portuguese. But it's amazing how you talk to, like, you hear people out, and it's like, I've managed to help this person. I've managed to give them a service that they were looking for. I answered a question, and I would tell them, like, in simple words, we're very hungry. Come give us food.
Excellent,
Yeah,
excellent, Jacobo. No, you are solving a big problem in the region, which you mentioned at the beginning of the interview, which was the accessibility and quality of the service. So, I mean, you don't. I mean, sometimes I've seen people standing in line for hours just to see a doctor, or just to get an appointment to see a
yeah,
doctor in a month.
that's right. That's the experience I have every time I go to the public hospitals in Mexico.
Yeah,
Like, people go
yeah.
there at 5 a.m. just to get a
Hmm.
ticket, or to get it,
A
a
ticket.
ticket to get in a line. And then when they get to the end of the line at 5 p.m., there's no more medicine. No, it's crazy.
Yeah,
I've seen it.
exactly.
I've
I
seen it
know.
with my
I
own
know.
eyes, and it's like, we're very, like, the noble purpose of our platform is what drives all of the people that work at HelloDoctor.
Excellent, Jacobo. Thank you for that. And you're doing an extraordinary job. I mean, congratulations. So, thank you for being here in the show today. I look forward to being in touch with you, and
Thank you, Julio. Thank
good
you, and I'm
luck.
very happy to be in this audience, and reach out if you want. And test the app. Test the app. It's for free.
Absolutely. I will download it myself, actually.
Thank you, Julio. All right.